Interoperability is important for sustainability because it is the key concept of the healthcare of the future. If we have this idea that in the future we will, as a society, be even better at caring for our citizens, we will have better solutions and we will have an easier time as citizens and as patients, moving in between different actors and caregivers. But also we will be able to utilize better all of the data that is generated in our world and to utilize that data more freely with different actors. All of that is enabled by or through interoperability.
Hi, and welcome to the Sustainable Healthcare Podcast. Joachim from Green Innovation Group here. And today with me I have Lasse, who's a senior consultant with us. And we are talking about interoperability in healthcare. So how can different healthcare systems, parts of healthcare systems speak better together, work better together? And why is it important for sustainability? So I hope you enjoy the episode. Do subscribe to our podcast on Spotify or Apple and check out more of the projects that we do for clients at greeninnovationgroup.com. Enjoy the episode. Welcome on the Sustainable Healthcare Podcast, Lasse. You are a senior consultant with us at Green Innovation Group, and today we're going to have a chat about interoperability, what it is and why it's important in a sustainability context.
Sure.
But first of all, who are you and what's been your journey into the world of sustainable healthcare?
Well, it's great to be here, first of all. My background is in organizational anthropology, and I'm also trained as a medical anthropologist. And I've been working in this field for, I would say, at least 5 years now. But actually, my initial interest was in the concept of capacity building and trying to improve organizations through different initiatives, facilitation, grassroots movement. And since 5 years ago, I've been really interested in trying to apply that to modern businesses, larger businesses, and specifically the sectors that have a large impact on our environment, healthcare being one of the major ones. So I've been really happy to work here for years now and to work on several types of projects, managing innovation, accelerators, and enabling collaboration across Nordic borders mostly, but working with some of the largest players in the healthcare space today, trying to accelerate their path towards the green transition.
Yeah, definitely. It's Lasse is, as you can hear, a good colleague, and I've also really enjoyed some of the projects we have done together for pharma clients with calculating business cases or doing training in various sustainability subjects. And through some of our projects, you have become a bit of the in-house expert on interoperability. What is that actually, interoperability, if you had to explain it to a 5-year-old?
I mean, it's a bit of a mouthful and definitely not something one becomes an expert in overnight. I think operability, in a general sense, addresses the ability of different systems to interact and to kind of speak with each other. And this can be on many different levels. In the context of the healthcare system and pharma and medtech businesses, interoperability refers to the ability of, for example, a device to interact and speak with a larger system. It refers also to the ability of different smaller healthcare systems, for example, the doctor at your hospital to interact with your dentist, or the ability of several hospitals in different regions in the same country to be able to work together smoothly. And it also refers to it on a larger scale, basically a regional scale, to say what is the ability of a Danish healthcare system, for example, to work together or to provide care for patients across borders and to utilize the knowledge that is generated in different healthcare contexts. So it's about complexity, and it's about the play and the combination of different systems at different levels.
Yeah. Yeah, it kind of lies in the word. I'm not able to do a full analysis that this part means this in Greek, but inter, we definitely have something between systems and then how they operate together, but also parts of the systems with the larger system and in this incredibly complex field of healthcare. Why is that important for sustainability?
It's an important concept because through our work we've engaged with hundreds and hundreds of different stakeholders from different aspects of the healthcare industry across the Nordic region and across Europe at large. It seems that the interoperability concept is absolutely key when talking about the healthcare system of the future. So if we have this idea that in the future we will as a society be even better at caring for our citizens, we will have better solutions and we will have an easier time as citizens and as patients of moving in between different actors and caregivers. But also we will be able to utilize better all of the data that is generated in our world and to utilize that data more freely with different actors. All of that is enabled by or through interoperability, we can say.
Yeah, and maybe that's a good stopping point to make, is that we really do need a healthcare system of the future. We've come tremendously far as a society, really just actually more than doubling the average lifespan of a human being and doing things that seemed like magic just 50 or 100 years ago. Yeah. But we're still looking into a future where, from our focus here in Green Innovation Group, there is no green transition without the healthcare industry. It's simply too large of a chunk of the global economy. In a lot of Western countries, we're looking at 6, 7, 8% of national emissions just from the healthcare system. So without fixing that, there's no reaching our climate goals. But then, as I think you also mentioned, that we're also looking at a population that's aging, and in general, in many cases, also that we are spending more on healthcare, especially from the developing countries coming up, but we're also demanding more and more from our healthcare systems.
Yeah, the complexity is growing in that sense. Yeah. So the issues that we're dealing with in our healthcare system are also growing in complexity as we age and as the population grows and the quality of life increases. We will have less of our time and energy spent on fixing broken legs and overworked backs, and more time spent on fixing a comorbidity of different issues, combining a specific allergy with some mental issues and perhaps this blood condition that you're dealing with as an 80-year-old, whatever it might be. So there's an interplay of different illnesses, and our health issues will be more complex. So also to address those growing complexities, I think we need a more comprehensive and more flexible healthcare system. So I think the point that I'm trying to make here is that interoperability is not only about saving resources and making things more easy and more accessible everywhere. It will enable that as well, but it's about resource efficiency at a very basic level, and it's about moving a sector that has been hugely important but also very slow to develop in certain aspects, and moving that into the 21st century and even the 22nd century when we get to it.
That's spot on, I think. Could you give us like a practical, simple example of how interoperability could play out, or perhaps where it doesn't work as well, is just as interesting. So where would you meet the barriers today of systems not speaking together in the healthcare system?
Definitely. So I think to start with an example that I think most people over their life will have a chance to relate to at some point. If you move your place of residency from, say, in Denmark, for example, and I imagine it's similar in most regions across the Nordic countries, for example. If you move from one city to a city which is in another hospital region, there is currently not an interplay between those systems necessarily. First of all, the the access to your medical file will have to be manually asked and granted by the players in those hospitals, respectively. And the systems that they use for managing whatever data is available in your medical file might not even be the same. So I know there's been several attempts at trying to unify the types of data that are available and the systems for managing that health data. But still, we are in a situation where whenever you move to a new city, or even more if you go to another country and visit and say, actually I broke my leg skiing in Norway, getting treatment there will not utilize all of the data that is actually available on you from a health perspective. So I think a lot of us encounter these limitations of the system in our daily lives, but we don't necessarily notice it because it's been like this always. So I think interoperability, it doesn't necessarily create a lot of problems as we see it because we know the system as it is, but it is a concept that points to a lot of the potential for how easy life could be, and not just in terms of giving you ease of access to treatment, but also for that treatment to be more precise and more specifically tuned to your specific conditions. So that would be the example of a kind of on organizational scale from one hospital to another hospital to your dental clinic to whatever it might be. These systems do not necessarily speak together, and if they do, it's usually a relatively cumbersome process. And I think the benefits that could accrue from changing this would be numerous, but just mapping out those potential benefits is a year-long project in itself. And just to give one other example, I think if you look at something like the smartphone in your pocket, I think that phone obviously tracks and collects a lot of data on you in many different ways. And I think as time will go forward, the types of data that it can collect will only increase, and the potential for utilizing that data will only increase. But right now, for some very good reasons, we have quite a bit of restriction on who can utilize and who can access that data, because we're scared that it will be sold and used in nefarious commercial ends, right? But what if all the data that is available on your phone in terms of when you sleep, how well you sleep, all these things that are happening in your life, your habits and what you seem to be completely consumed by, or what issues you might have based on your search history on YouTube for chiropractor videos, whatever it might be, all of these things, if that was somehow efficiently and anonymously available for your doctor or your specialist at the hospital, or even just for the hospital computers to be able to aggregate and analyze at a larger population scale, I think the amount of data that we could have on us as a population would greatly increase. And would allow a lot of developments, both in terms of new treatment options, new medicines, and new ways of handling your care in your everyday life.
Yeah, and there's some super interesting practical studies with quite promising results on predicting stuff, everything from COVID to various other needed treatments, just out of the data collected from a smartphone. There's a key tension here, I hear you saying, between that within interoperability, it's much more than data, but data is a big part of it. And there's both a perceived and practical tension between individual privacy and data privacy, and also so much of the potential improvements in treatment coming from data, both at an individual level, but also at an aggregate level. And then it just shook me that because the systems are so complex, with a lot of moving parts, a lot of moving people and systems, that interoperability is not a fixed state. You go, it's perhaps more sort of a destination that you never reach, but that it's a goal, and it's just when you think the systems are talking together, then you have to keep making them talk more together. Would you agree on that?
Yeah, definitely. And I think as a concept in that way, it's kind of related to the, at this point, ubiquitous term of sustainability, because it's something that we all know is important and we all want to be working with it, but we all don't really have a clear idea of when do we get there. And probably it's not a goal that we would reach at a certain point, but it's kind of a way to describe one of the conditions that we should put on ourselves in deciding what we work for and what we work towards as individuals and as an organization. And I think interoperability speaks to to your flexibility and your awareness of other systems around your system, right? Whether it's for a product or for an organization, what are the interfaces with other actors in this field? And be mindful of those potential avenues for interplay, collaboration, innovation, etc. Yeah.
What does this mean for the collaboration between commercial players in the industry like medtech or pharma companies and the treatment and healthcare services part of the industry, which can of course both be public and private, because it's a very interesting industry in the sense that there's so much that happens in collaboration, whether it's clinical trials or more back and forth movements with products and product training than most industries.
Yeah.
So if I'm a private pharma company, let's say, what does interoperability mean for me?
To say something that might be unpopular if you're an executive at a pharma company, I think a big part, at least from the kind of the anthropological side of things, when we talk about interoperability, the big point that is here is that if we want to get there, if we want to go in this direction of interoperability, we kind of need to, if not abolish, then at least find alternatives to this idea that your proprietary data as a company, the one that you generate through your user sales and your user experiences with your product or whatever it might be, that this data is somehow yours and this data constitutes your competitive edge. Because if we continue to see the competitive edge arising or as being layered into the walls between collaborations and the walls between data usage, we will not be reaching the healthcare system of the future. Because especially if you want to start having meaningful collaborations and actual usage across systems between public and private actors, you most certainly need to look at this in a very different way. And the collaborations need to be defined not by what is my gain as an individual and organization and what is your gain, and then maybe we can look from each of our bunkers into and see what is the common gain here, but to start from a different perspective, which is there something here that we both want to achieve? Is there a common goal here that we can work towards that is a meaningful goal for this collaboration?
Some people call it non-competitive spaces. I mean, now we're getting a bit on the high-flying terms, but I think when we're talking about sustainability in the healthcare industry, one of the key things is that you have to look at it at a system level and not as a binary transaction level. Exactly. And we know this from the circular economy, but there's a lot of places where we need to collaborate. I think good example could be take-back solutions for drugs or medical devices, where I'm a highly specialized pharma company, I make these drugs and APIs and these treatments. I shouldn't also be doing waste handling.
Right.
It makes sense that we find some industry solution that we all know together, or none of us own, but that could collect for all of us. Yeah. That takes a kind of collaboration.
There's a lot of talk about innovation, and I think a lot of, at least for the past couple of decades, it's been the buzzword of the year for a while. But I think it's interesting to keep in mind regarding interoperability that the innovation that we're looking for is not necessarily in terms of let's get more data or let's find ways to anonymize the data. We actually do have a lot of the technologies that are needed to make many of these developments happen and to also make these collaborations happen. What is actually needed is innovation in terms of legal frameworks and frameworks for this collaboration. And this is where I see especially the public sphere playing a large role. Instead of trying to just ask huge companies with very strong incentives to protect their own IP and their own silo, let's say, instead of expecting them to come out and say, okay, let's start collaborating with everybody and hope for the best. Why not use some of the public money that is addressing these issues to try to innovate on the structures for how is such a collaboration set up, on the legal frameworks for what does a mutual gain look like, what does a mutual commitment look like, and what could be systems to manage also across public-private borders, what could be systems to manage the projects and the efforts that we make in this field, and could we design new ways of dividing the gains? It's very much a winner takes all commercial field right now, at least in the private sector of the healthcare companies, and I think looking for alternatives to that model of operating is what is needed to factor in interoperability to the fullest, I would say. So that's a way to get from the high flying, or let's all collaborate, kumbaya, and more down to we actually need some legal frameworks and a way to set up collaborations that have not been done yet. We need both a big protection of everybody involved, all the stakeholders, and we need some clear paths for how to utilize the data that is put in, and how to utilize the gains that come from developing new solutions.
That's a super good point, and I think it's an interesting thing that we're seeing a lot of places where we are working with clients and doing innovation in the healthcare industry, that ballpark shot 8 out of 10 times what is needed is new ways of applying existing technology, of collaborating, of calculating the businesses differently, and training people in something, employees in something that we already know. And it's really only in 10 or 20% of the cases where we actually need new, radical technology. So many times it's the implementation or adoption of existing things.
If I could just add a note to that, because I think I don't want it to sound like we are at the bottom of the S-curve and nothing's happening, and if only people could see the joys of interoperability, everything would be great. There are a lot of efforts already of the type that I was mentioned. Of course, we are part of some projects, both with private and public and semi-public actors that put in the effort to try to reach a more shared and a more interoperable healthcare system of the future. And specifically, I want to highlight the efforts in the Nordic Commons project, which is an effort to try to consolidate data types and data frameworks in the Nordic region, and also the Nordic Interoperability project, which is designed towards finding new solutions to both the legal frameworks that I was mentioning, but other ways of collaborating between actors as well. And these are interesting efforts, but I think we need a more wide-scale adoption and a wide-scale effort for this to actually make a meaningful difference, and to actually make significant steps towards that healthcare system of the future.
What would the healthcare system of the future look like? If you take me as a passenger journey, we are some years into the future, something happens, I break a hip or something, maybe I move somewhere. What does it look like?
I mean, so again, to kind of reuse the example from before, if you fall and you break your hip, but you're not in your home, and you're not in your hometown even, you might even be in another country where you have your residency and your citizenship. With proper use of interoperability, it should be possible for the hospital or the clinic that treats you wherever you are to find out who are you, and then to somehow ask for and get access to the data that is relevant to your medical condition at this point. The question is, how do we do that without them being like, okay, now we know exactly everything about Joachim, and once he leaves the house, we can still utilize that data to further our own goals and in a commercial setting. So I think in the ideal version of the future, you would be able to go to a completely different setting, get not only the full treatment, but actually get a treatment that takes into account actually when you come in, if you've blacked out and there seems to be some kind of infection. Maybe it's good for them to know that you actually have a penicillin allergy or you are deadly scared of needles or whatever it might be. Something that could be in your medical journal or adjacent to it, and they should have access, in my mind, to that kind of data for them to provide better care for you. And this might seem like an element of convenience. So in this utopian future where everybody can access the treatment anywhere, that it's good for the people who travel a lot and who have a lot of money and who have access to all of these things anyway and who have the mobility. But this is actually also an issue that addresses the questions of equality and inclusion in terms of access to health, in the sense that right now we can see statistically there's a quite big difference between the care you are afforded within a certain or with a certain illness if you are in the region and area that has a particular expertise in this. So if you are in the region of, I don't know the specifics, but for example Stockholm, and they are, let's say they're really good at everything to do with osteoporosis, whatever it might be. If you are in that region, if you have a regular connection to that region, you will have a better treatment likely or statistically than if you come from the countryside and you only have access to your own GP. The interoperability is also a way for systems to talk together and allow this GP in a remote area to actually access cutting-edge knowledge and the best possible analysis, maybe based on AI, algorithmic analysis of population data, to actually find out, okay, so in a case like this guy who comes in, he's called Joachim and he just broke his hip, the best type of treatment in this case, a specific case, would be akin to this. So I think it should help us all ideally in the healthcare of the future, and it should be a world where we can utilize we know there's a lot of data being generated. Again, the smartphone is a great example. I mean, we know there's a lot of data being generated, but rather than being scared and wondering like, I was just talking with a friend about getting a new barbecue, and suddenly I get all the commercials for a barbecue on my phone. But rather than it going that way, we would love to see it go in a direction where, because this phone has access to a lot of things about you, and let's utilize that data in a way that improves your life and improves your life quality and improves your health, and maybe even prevents certain illnesses from ever arising, if possible.
So if you had to sum it up, why is interoperability important for sustainability?
Interoperability is important for sustainability because it is the key concept of the healthcare of the future. And the healthcare of the future is not only more efficient, it's providing better treatment for all citizens, not only those in the most populated metropolitan areas. It allows organizations to develop treatments faster and to utilize more data in whatever treatment and APIs they might develop. And this should provide better healthcare for everyone at a lower cost as well, financially and of course environmentally. The future of interoperability also, we haven't really touched upon this, but it also allows the full host of digital health efforts. So everything within telehealth in terms of remote use of technologies would also be made easier and better by improved interoperability. And as we know, that greatly reduces the resources spent on transportation and treatment that are not effective. And so by increasing precision, by increasing mobility and access, and increasing efficiency, we actually attack the sustainability of the healthcare system from several angles at the same time.
Yeah, spot on. And yeah, there's definitely a follow-up episode of 3 on telemedicine and preventive healthcare and how they interplay on
precision medicine
interoperability. Yeah, precision medicine. It's good that we have more episodes to record. Thank you so much for coming, Lasse. It's a super joy to have you on the podcast.
You're welcome.
Joachim from Green Racing Group here again. I hope you enjoyed the episode. It was really fun to do and just always nice to revisit the insights from our projects. We are coming out with our report soon, in collaboration with Nordic Innovation, which touches a lot upon interoperability as well, and better use of health data in the Nordics. We will link to that either on our website or in the show notes. Hope you enjoyed the episode. Have a great day.